Welcome to everyone tuning in today, and thanks for joining us. I'm Christine Camizio, Health Editor with U.S. News and World Report. Next week, as we launch the U.S. News 2020 to 2021 Best Hospital Rankings, we're also honored to recognize an array of health professionals across the country who are working tirelessly on the front lines of the COVID-19 pandemic. Through our special U.S. News Hospital Hero series, we've been profiling more than 50 of our nation's frontline healthcare workers, from housekeepers to physicians to flight nurses and everywhere in between, who are facing this pandemic head on. Here with us today, we have internationally renowned infectious disease expert, Dr. Peter Hotez, who we profiled recently as a part of this series. Dr. Hotez is co-director of the Center for Vaccine Development at Texas Children's Hospital in Houston, where we've seen hospitals filling up as COVID-19 cases spike in recent weeks. He's also Dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, welcome and thank you so much for joining us.
Oh, well, thanks for having me.
So let's start with your hometown, Dr. Hotez. Houston has seen a massive surge in coronavirus cases since the end of June. Right now, the city is facing nearly 60,000 confirmed cases total, and we're seeing more than 350,000 across Texas. Can you describe the situation on the ground?
Well, you know, we're part of this massive resurgence across the American South, going everywhere from Florida to the eastern states, Texas, New Mexico, Oklahoma, Arizona, and Southern California. Right now, the southern U.S. tragically accounts for about a quarter of the world's COVID-19 cases. So when you look at the world's epicenters of the pandemic, it's South Africa, India, Brazil, and the southern United States. And so this is horrible. One of the things that not many people are talking about is the fact that it's low-income neighborhoods in particular that seem to be being devastated. So especially among people of color, African American, Hispanic, essential workers who, you know, don't have the luxury of working at home and remotely via Skype and Zoom and have to physically be in the workplace, and they're just hit very hard, and it's a very tragic loss of life. And the city of Houston puts out every day lists of people who've died in the COVID-19 epidemic, and they don't provide the names, but they provide the age and race and ethnicity, and it's, you know, it's just very heartbreaking. Hispanic, Black, Hispanic, the list goes down. And this is one of the reasons why being so out there speaking out is, I feel like our nation is failing vulnerable populations.
Yeah, and how about where you are in Texas Children's Hospital? What are you seeing there kind of in the hallways, and how is the hospital and the broader Texas Medical Center handling this surge in hospitalizations and deaths?
Well, Texas Children's, of course, is a pediatric hospital. We have been taking out adult patients, but we do see unique pediatric manifestations of the illness. Our group is mainly focused on the research side, trying to develop vaccines for coronaviruses. We've been doing that for the last decade, and as well as parasitic diseases of the poor. So Texas Children's, which, you know, has always been nicely ranked by U.S. News and World Report, also has a major research arm, and that includes research devoted to global health. So we make vaccines that drug companies don't ordinarily make because they're for diseases of the poorest people. We make vaccines for schistosomiasis and leishmaniasis and Chagas disease. I like to say the most important diseases you've never heard of. They're very common. It's just that they're among the poorest of the poor. And then a decade ago, we connected with a group around coronavirus vaccines, because back then nobody cared about coronaviruses, and we knew they'd be very important. And suddenly, starting in January, people got interested in them again. And we have a COVID-19 vaccine that we're accelerating. And what's unique about it is the fact that since we've always focused on low-cost global health vaccines, we've made our COVID-19 vaccine with that approach. So we have a recombinant protein vaccine made in yeast that we're hoping to accelerate for low and middle income countries.
Great. Yeah, let's talk about that a little bit because you spent much of your career not only fighting disease, but really focusing on how disease affects people in poverty. And this is something you touched on as well when we profiled you for the Hospital Heroes series, is that you're focusing on getting this vaccine available to low-income countries. What does that approach look like exactly? How are we making a vaccine more accessible? How is that accomplished?
Well, so you're right. I write and speak a lot about diseases of the poor. And one of the books that I wrote a few years back called Blue Marble Health actually finds when you look at poverty-related diseases, they're not necessarily only in the poorest, most devastated countries of sub-Saharan Africa and Southeast Asia, as many assert, but in fact, it's the poor living in wealthy countries that accounts for most of the world's poverty-related diseases. And that includes diseases like worm infections and leishmaniasis and Chagas disease and dengue and leprosy and tuberculosis, and the list goes on. And COVID-19 is really much going by that same playbook. It's the poor in the G20 nations in Brazil, India, and now the poor in the United States that are getting hit the hardest. And we've always focused on low-cost vaccines that build on the fact that you want to make a vaccine that it can actually be made locally. So our recombinant protein vaccine uses the same technology used to make the recombinant hepatitis B vaccine, made in places like India and Bangladesh and Cuba and Indonesia. And we think on that basis alone, it's going to be very advantageous because rather than some of the expensive new technologies that may not be scaled in low and middle income countries, ours is set up to do that. So we have a great partnership with an organization called PATH that's based in Seattle, and they historically have done a lot of work with the Gates Foundation. They led the development of the malaria vaccine for Africa, the meningococcal A vaccine for Africa, and now they're partnering with us in our Texas Children's Center for Vaccine Development at the National School of Tropical Medicine at Baylor, and it's co-led by myself and my science partner of 20 years, Mary Elena Batazzi, and we're very excited. We hope to have an announcement soon of how we're going to scale this up for India, and so that's very gratifying. In the meantime, in addition to the vaccine work, I've had this unique opportunity to speak to the nation on the cable news networks, and that is both daunting but I think very important, really trying to cement home the idea that this is a health disparity and a disease of the poor, and not many are emphasizing that. And this is what's getting me so upset and worried is, when you see how Hispanic and African American communities are just being so devastated, and there's things we can do about it that we don't, and trying to create a plan for the nation where right now there doesn't seem to be a lot of interest in that. So much of this is right now in the country is focused on having the states take the lead and the federal government will provide backup support, and it's clearly failing. We have, of course, the most COVID cases in the country and still climbing with no end in sight. So this week I put out a plan for the White House and the federal government to begin getting our country back in line and trying to slow or even halt our COVID-19 epidemic. We can do it, but it does take political will.
Great, let's talk about that plan a little bit. As you said, you just put it out this week and you're giving us a little bit of hope for 2020. Your plan shows that there really is a way for us to turn around and return Americans safely to the workplace, to schools, sporting events even by October. Can you tell us a little bit about your plan and how exactly we do that successfully?
Yeah, it's pretty high level and deliberately does not have a lot of detail because there's information that the states and the federal government have that I don't have access to, but it's remarkable for its simplicity. It essentially says, look, Europe has contained its COVID-19 epidemics, or there are COVID-19 epidemics, so has Canada. Mm-hmm. Can do the same, and we can bring our whole nation back to containment mode by October 1. And people define containment in various ways. Some use the metric of 1 new case per million residents per day. And we need to come up with some agreed upon low level. And when you do that, that actually makes contact tracing possible. You can't do contact tracing if you've got 1,500 confirmed cases a day in Houston, and we know there's 3 to 10 times more than that. It just becomes too unwieldy. It's too labor intensive. Same in Miami and San Antonio. So the idea is you bring it down to that containment mode, and then you can really, now that we have our public health infrastructure in place, the contact tracers are hired, we can actually prevent the resurgence this time, whereas before we didn't do it, especially if we get everybody in masks at that point. And then we can even do things like open up schools or even colleges. We can't do that now when it's unfair to the teachers and the students and the parents and the staff and the bus drivers to try to open schools in the middle of a raging COVID epidemic in the South, when you know within a week or two, teachers will start to get sick, as will the staff. And we're basically asking the teachers to pay the price for the failings of our elected leaders, and I won't have it. So, and I've been talking about this, on the networks for a while, and finally, when I haven't seen a plan forthcoming, decided, well, let me put something out there and go ahead, throw darts at it, and tell me why on social media it's not going to work. That's absolutely fine, but at least put something on the table for people to look at, because right now it's just a vacuum up there.
So you talked about mask wearing, contact tracing. What else are you looking for in this plan that you think would be effective?
Well, I think some states like Maine and Vermont may already be at that containment level. They may not have to do much beyond what they're already doing, but other states like Texas and Florida and Arizona and now Louisiana and the other southern states, we may have to go into shutdown or lockdown for a period of time to bring it all the way down. And people will say, oh, that's just too heartbreaking. Well, nothing's more heartbreaking than we have right now. We have 200 deaths yesterday in Texas. And so many states across the southern part of the US, COVID-19 is once again the single leading cause of death on a daily basis, just like it was in New York and back in March and April. And again, it's mostly people living in poverty that are bearing the brunt of this. And we can do better than that as a country. So let's do it right this time, bring the whole country back down to containment mode, and then we can start opening up safely and have a reasonable fall. And one of the problems is we're sending the wrong message that it's just a matter of waiting for the vaccine. And I'm as big a vaccine proponent as anyone, but vaccines will not be available till next year. And even when they are, many of them may not prevent infection. They may just prevent you from getting very sick. So we'll still have to keep those public health measures in place. Even when we have the vaccine, it won't be a magic solution.
Absolutely. You mentioned there, you've really been urging the White House to adopt a national strategic plan. And while you're fighting off, attacks on social media, you recently took to Twitter encouraging the federal government to please copy, paraphrase, revise, take credit for whatever you want out of this plan, asking that they just look after the vulnerable and essential workers. Is your voice and the voice of other medical scientists being heard in the national equation?
I think so. I think more than ever we've been out there, and that's good. The problem is there are not a lot of scientists who feel comfortable doing that public engagement. It's not in our training, especially for physician scientists. We don't get taught how to talk to the public. And I think that's one of the lessons learned from this is now that we've got all of these rising anti-science movements, because the anti-vaccine movements are now enlarged their remit and are campaigning against masks and social distancing. And they're marching on state capitals in many parts of the country. My premise is that part of that is because we don't have scientists out there in the public domain. People don't hear enough from scientists, and that vacuum allows anti-science movements to flourish. And I have a paper that came out in the Public Library of Science a few weeks back called Combating Anti-Science in the 2020s. It was in PLOS Biology, and it argues that we need to build in programs of public engagement, teaching scientists, especially physician scientists, how to do this, because right now we're so inward looking. We're all focused on our grants and our papers and writing and speaking for each other that we've lost that ability. And that's why I commend US News for putting out podcasts and Facebook chats like this, because people need to see the face of scientists and physicians and healthcare providers. And I think, there's not many silver linings in this epidemic, but maybe that's something along those lines, that people are hearing from scientists, physicians, scientists, and healthcare providers now.
Absolutely, that's so important. And how about, you've really gotten out there and gotten yourself out there. What advice do you have for other medical and scientific experts that are just starting out and just trying to make their voice heard, to contribute their voice and make themselves heard as part of a national strategic plan?
Yeah, I think it's really important. First of all, it's not for everybody. Not everyone has the personality and wants to do that. I would say one of the things to realize is that if you're an academic health center, especially, most academic health centers have offices of communication, and have a conversation with people in that office. Let them know you want to do it. Maybe they'll provide opportunities for training. And it's a two-edged sword, because some academic health centers actually don't like having their docs and their scientists out there talking. They because their job is also to protect the institution and the reputation of the institutions. And many offices are actually quite suspicious of or concerned about having their docs and their scientists out front. And it's sort of an antiquated way of thinking. But we need, especially now that anti-science movements dominate the internet, by some estimates, there's 480 anti-vaccine websites out there, all ramped up on social media platforms. Amazon is basically an anti-vaccine website. If you click on the vaccination books on Amazon, it's all fake anti-vaccine books. So we're losing the battle, and the best way to fight that, I think, is to have a cadre of scientists out there who understand the science and have the interest in explaining it to public audiences. And there's an art to doing it, because I think one of the problems that I've seen among scientists and physicians talk to the public, they tend to go off in one or two directions that's off-putting. Either they use a lot of jargon and have the inability to really get through to the public, or more commonly what they do is the other extreme, which is that they try to dumb it down and they talk in a way that then sounds very condescending. And that's not effective either. It's striking that balance of being able to explain complicated ideas, but doing it in a way that both makes people understand it and really gives them a sense of what the scientific process is all about, and making them understand the uncertainty that sometimes goes behind some of those statements. And it takes time to learn how to do that. And I did it trial by fire, but it would be great if we could provide some instructions on how to do that better.
For sure. And fighting misinformation and also anti-science, this isn't something that's new for you either. It even strikes a personal chord for you and your family. Just a few years ago, you wrote a book called Vaccines Did Not Cause Rachel's Autism. Can you tell us about the inspiration behind this book?
Yeah, it was. We had moved to Texas, to the Texas Medical Center in Baylor and Texas Children's about a decade ago. And one of the things that struck me was there was this very aggressive rise in the number of kids whose parents were opting them out of getting vaccinated. Mm-hmm. And it was all because a anti-vaccine lobby had formed. And in this case, it was attached to the extreme far right, and they were using these fake concepts like health freedom. That was the term they were using, health freedom or medical freedom. It was really made up, but it was very convincing. And they were claiming that vaccines caused autism. And I said, well, here I have a daughter with autism, and I know the evidence that vaccines don't cause autism, and I know from the scientific literature about the multiple genes involved in early fetal brain development that explains autism spectrum disorder. So if I don't speak up about it, who will? And began putting that information out there. I'd written books in the past about science and public engagement and raising awareness about poverty-related neglected diseases, but took this on, and it's not been easy because the anti-vaccine lobby likes to gang tackle, and they're very aggressive. And but I think I've really made some headway in terms of explaining to people why vaccines don't cause autism. But then something else happened in the last few months. And, among the other things that the anti-vaccine lobby claims, other than vaccines cause autism or other chronic illnesses, they assert that vaccines are rushed, not adequately tested for safety. They also claim that there's this conspiratorial relationship between the pharma companies and the U.S. government. Mm-hmm. Operation Warp Speed comes along out of the White House for the national COVID-19 vaccine program, and it made every mistake in the book. First, it called it Operation Warp Speed, which gave the impression that vaccines are being rushed. And then you heard about some of the companies dumping stock and sending out misleading press releases. All that stuff played right into the hands of the anti-vaccine groups. And mm-hmm. both Reuters and the Associated Press have come out with these two polls that found that up to half of Americans will refuse COVID-19 vaccines even if they become available. So this is, my premise is this was a self-inflicted wound. We didn't have to get there, but the message was mangled again. It's this very inadequate or poor level of science communication continues to get us into trouble.
Sure. This will be something new for people, this vaccine. How would you aim to ease the anxiety for people who are hesitant to get a new vaccine like this, or are outright against getting one for themselves or their children?
Well, I think one, we're going to have a communication strategy and explain that these vaccines are not being, if the warp speed part is not in the safety trials or the clinical trials showing they work. The warp speed part is manufacturing now before whether we know they're going to work or not, with the understanding that if they don't, they simply won't be used. And also explaining that the other way to accelerate things is to get multiple shots on goal at the same time. So try multiple different technologies. Mm-hmm. So the fast timelines are nothing to do with the clinical trials. But again, we don't really have the White House communicating that. And so it's left to a handful of academics, medical school professors like myself to explain it. And it's okay, but it's we don't have that accountability since we're not part of Operation Warp Speed. So we've got to get the U.S. government to fix that.
Definitely. Now, are you seeing parallels between the anti-vax movement and the anti-mask movement?
Yeah, the same groups that are campaigning against vaccines now have enlarged their remit. So now they're campaigning against masks, all under this banner of health freedom again, masks and contact tracing and social distancing. Mm-hmm. And they can be very effective, and unfortunately they're having an impact because many people now see not wearing a mask or resisting contact tracing as a badge of honor. It's not, of course. It's just jeopardizing the health of Texans and people in other states, and yet that's the situation we're in. So we've got a lot of work to do, and I'm doing my best, but we're going to need others to join on. And again, we need that federal leadership to highlight its importance.
Mm-hmm. And something you said earlier was that this was a vaccine was on your radar years before when nobody was interested in it. So let's go back to 2016. You were developing a vaccine to treat a deadly strain of the coronavirus, but you hit a wall then. Why was this already on your radar far before COVID-19 emerged, and what happened there?
Well, we had seen the original SARS-1 emerge in 2003, and then MERS in 2012, Middle Eastern Respiratory Syndrome. We knew it was a matter of time before we would see other pandemic coronaviruses.
Mhm.
So even though we're not virologists, we mainly developed parasitic disease vaccines. We got connected with a group at the New York Blood Center that had led this concept that they could develop a vaccine that gave high amounts of virus neutralizing antibody and yet was not causing immunopathology or immune enhancement that we had seen, that have been seen sometimes in experimental animals. And we applied to the NIH for support. We got that funded, and now we've used that same technology approach to do this binding domain of SARS-2, and that's what's being scaled and used, and hopefully soon we'll be able to scale up production in India and begin clinical trials. So we're quite excited about that.
That's great. How are you feeling when you where you were at a couple of years ago were put on pause, and now you're watching our country struggle to fight COVID-19, not just our country, across the world struggle to fight COVID-19, particularly right now in Houston where you are, knowing that there was potentially this missed opportunity to get out ahead of the pandemic?
Well, we're able to hit the ground running with our vaccine, so that clearly helped. But the point is, we've got to do a better job with pandemic preparedness.
Mm-hmm.
Coronaviruses were coming, and they're going to continue to show up. This will not be our last coronavirus pandemic, so we need to have an infrastructure in place for preparing multiple coronavirus vaccines. Just like we do for influenza, we have a pretty in-depth structure for flu, and I think we've got to now look seriously at coronaviruses. So we've basically seen a deadly coronavirus emerge every decade in this 21st century, and I think we have to recognize that this is going to be the new world order, that we're going to continue to have coronaviruses. We need to be ready for them.
Wow. So right now, if we don't move towards adopting this strategic national plan that you talked so much about, what if we don't take those steps as a nation right now? What are we here facing for the months ahead?
Well, doing nothing is not really an option. Doing nothing means the Institute for Health Metrics now predicts 220,000 deaths by October, and then maybe 300,000 deaths by the end of the year. And it's not just the deaths. We're now seeing permanent injury, permanent lung injury, heart injury, vascular injury, neurologic injury, cognitive declines. So this will inflict permanent damage to our nation if we don't take steps now to mitigate it. And we've got to recognize that putting the states out front was a failed strategy and was destined to fail from the very beginning. And waiting for a vaccine is not an option. One, vaccines won't have that dramatic an impact, number one, and number two, they'll come too late. So we've got to take steps now.
Definitely. You've made such a commitment to keeping the public educated. You've really been a constant face on national television these last several weeks. What's one thing you think you haven't been asked yet that is really important to get out there?
That sometimes feels like I've been asked everything. I think the one piece that I've been really trying to stress is there's, and the way the White House sometimes messages things about vaccines as they did hydroxychloroquine, that is just they tend to veer towards miracle solutions.
Mm-hmm.
Or like that, especially if some of the vaccines are only, reducing the likelihood you're really ill, but not interrupt transmission of the virus. That we're still going to need the public health measures like masks and contact tracing and social distancing. So we better get good at it now and bring us down to containment mode, and then get some semblance of a normal life restored in America. And then when the vaccines come along, it'll just make it that much easier, but recognize these vaccines will be companion technologies, most likely not replacement technology.
Sure. I want to be mindful of your time. I know you've got so much going on here, so just have another question or two for you. Right now, you're clearly putting in really long days. You know, before sunrise, you're getting up, you're working well into the night. How are you and your colleagues staying resilient and combating the stress and the high potential for burnout right now?
Yeah, no, it is exhausting. You know, I'll wake up at 4 or 5 and text my colleague, Dr. Patazzi, and see she's already sent me a text at 3:45, and
Wow.
we're not taking care of ourselves as well as we should. And everyone's, you know, coming into the lab still because we've got a team trying to develop COVID-19 vaccines. They really are heroes. And but you're right, it's just been this unrelenting pace since January. Exhilarating also, and you know, and this is why we got our training in science to be able to make a difference. People often don't appreciate that so many scientists are driven by humanitarian goals. So, you know, the privilege of being able to make a difference in the world is exhilarating. But and we're not getting burned out yet, but it is emotionally draining, and there are tears, and people get upset, and they say things they wish they hadn't, and we're all doing that. And this is just a time when we have to be very kind and forgiving towards one another, and that's what we're doing.
Mm-hmm. Fantastic. Thank you. We have one question, if you have time, from one of our audience members. Someone asked, what keeps Dr. Hotez up at night?
Well, what keeps me up at night especially is, as terrible as things are right now in the United States, and no real commitment towards a federal plan, you know, when you see the pictures of the crowded urban slums of Bangladesh or India or Indonesia or in Ecuador and Brazil, you know, how do you do social distancing there? And I'm just worried as we move throughout the summer, this virus is just going to slaughter so many people in the global south, in the southern hemisphere. And I just don't want to see that happen. And this is what really keeps me up at night, is doing everything we can to get our vaccine out into clinical trials so we can help the world's poorest people.
Great. Thank you so much for sharing. Well, Dr. Hotez, we really appreciate your efforts, and also thank you so much for taking time out of such a busy day right now. Thank you for being with us here today.
Well, thank you, and thank you for the recognition from U.S. News World Report. It means a lot. I appreciate it.
Absolutely. If you want to read Dr. Hotez's full story as part of our Hospital Heroes series, you can visit us online at health.usnews.com/hospital-heroes. And if you have a hospital hero in mind, feel free to put them on our radar. You can email us at hospitalheroes@usnews.com. So thank you again so much, Dr. Hotez, and to everyone who tuned in, and we will see you next time.
Thank you again, and thanks for all your hard work.
Thanks.